like to talk to you guys about twin-to-twin transfusion syndrome. It's a disease that affects identical twins while they're in gestation. They're usually around the 14 to 16 week area, 18 week area. It's where one twin unknowingly gets more fluid and blood than the other twin, and it just keeps increasing because one twin will send out a signal saying he needs more water and blood, which the mom provides, but for some reason he gives it to the other baby. It's known as a donor baby and a recipient baby, and obviously the recipient's the one getting more of his share. It's most commonly found in the monochorionic placentas, which is about 15% of the identical twin pregnancies. There's only a few places in the United States that does the surgeries. The ones that we actually went to were in Houston. It was Dr. Johnson did our surgery. This is a pretty long, drawn-out event, but my wife and I went down to Houston, and almost an emergency type deal. We were at a stage 3, from a 1 being the least amount and 5 being the worst amount. We were at a stage 3. So when we showed up, we pretty much got right in and did ultrasounds for half the day. And then the second half of the day, we actually were in surgery the entire time. And they were able to map the blood veins and vessels to which baby was which and who was getting more, and they were actually able to correct that with laser surgery, which was supposed to only take a couple hours, ended up taking 4 to 5 hours. We actually got some really cool pictures out of the deal, some actual pictures of both boys when they were in the womb at 18 weeks, and everything went great. Surgery went well. We actually got back home, which was about 7 hours away from Houston, and about 3 days later, our water broke, so we ended up back at the hospital again, just here in Norman, not in Houston. So anyway, roughly 4 months later, 3 months of that in the hospital, we successfully gave birth to twin boys at 32 weeks old, and they stayed in the NICU for about a month, and after that we came home. Pretty much the TTTS is a disease that only affects them in the womb, not after they're born. They're usually fine after. They're generally born pretty early, so they have some breathing issues, and they sometimes need blood transfusions and other things, that just because they were born at such an early age. But one way to notice this, if you happen to be pregnant with identical twins and you have not yet seen a maternal fetal medicine doctor or a high-risk specialist, which happened to us, we had not seen him yet. We just went to the OBGYN, and we were a few days out from our appointment, and we noticed that suddenly her stomach almost doubled in size, almost pretty much overnight. So anyway, that is one sign of it, because like I was saying earlier, how one twin will be basically in need of blood and fluid and sending signals out, and the other's getting all the fluid, so he just keeps getting more and more and more when the other's getting none. So it keeps a huge imbalance. When my wife had surgery, they actually took out right at 2 liters of fluid on one baby. So the recipient had over 2 liters of fluid just for himself. And we're talking, they were 5 inches long from head to butt. So that was way too much fluid for one baby. The other had none, and he was stuck up at the top because he had none, and he was forced to the top. If everything was normal, he should have had fluid, and gravity would have pulled him back down before they've been side by side rather than top and bottom. That is one warning sign though, is waking up and literally doubling in size. Another one's trust your instincts. If you feel like something's not right, it's probably not, and you need to get to the doctor as soon as you can. The other is trust in your doctors. If you've seen the MFM, they know what they're talking about. Trust in your doctors, but still need to ask questions if you don't understand. And definitely, without a doubt, trust in God. That's the most important thing. And like any disease or anything in life, you should always pray first and then worry about the doctors. And that goes with any situation in life, not just any disease. But anyway, I hope the information was helpful. Maybe everybody together can bring awareness to this and hopefully put an end to not being seen at a proper time and getting help when you need to. And hopefully with information gained we can help save unborn lives. Anyway, thank you.